we are going to invite to the stage. Sorry, I'm seeing two things. Atholl Kleinhans and Eimear McGlinchy. My job here really is just decoration. This is all about Atholl, who was joining us yesterday, and Eimear, who has joined us previously and is a long-standing Creative Brain Week. In a way, what was nice about the link was with Una was about things that started here. I love as Creative Brain Week is developing that there are many things happening in Creative Brain Week I have no idea about. I found about them afterwards, and this actually is one of them. You might just briefly introduce yourselves to start with.
So, hi everyone, my name is Eimear McGlinchy. I'm a fellow and a faculty at GBHI and also an assistant professor in intellectual disability here in Trinity.
My name is Atholl Kleinhans. I'm a Global Atlantic Fellow for Health Equity, and I'm a public health practitioner in South Africa.
You met here at Creative Brain Week, and tell us a little bit about what you were talking about to each other. And where your conversation has started from, where you're going to. I'm literally here to prompt.
Thank you. So yeah, we met, I believe it was 3 years ago, I think it was 2023, where we held a session here. The theme at the time was joy, and we were holding a session on dementia in people with Down syndrome. And I remember I invited Juan Fertea to speak at it, and first it seemed kind of jarring to be speaking about Down syndrome associated Alzheimer's disease in tandem with the theme of joy. But really the theme of the whole session was first around hope, and I think there is now a lot of hope in terms of prevention and treatment for Alzheimer's disease in people with Down syndrome. But we also had many self-advocates with Down syndrome who were sharing their experience, so either their experience in terms of opportunities for employment, in terms of experience as self-advocates. There was one man with Down syndrome who is the first person with Down syndrome who has been elected to Fianna Fáil. And so I think throughout the day it really was, with Mike Hanrahan, who's here, we sang a song that were written by the group with Down syndrome. And I think the session really successfully spoke about joy, even when talking about Alzheimer's disease.
You were sat in the audience. You touched a little bit on this yesterday. What happened?
Yeah, so like Eimear was saying, we had a session on Down syndrome, and I was sitting there, and while the theme was pure joy and really for the self-advocates to share their experiences, I felt a deep sense of something stirred in me because my lived experience with people with Down syndrome in South Africa was totally different. I have never seen, well back then, never seen a person with Down syndrome standing on a stage and deliver a almost perfect speech, almost better than some of my colleagues. And so I had to do something about this feeling. And so I spoke to Dominic, who introduced me to Eimear, and I think it was at the Provost gathering, that we had a conversation, and this is where we decided to work on a project in South Africa. We got a Connect grant from the Atlantic Institute, and Eimear came over to South Africa, and we started thinking about what we should do in South Africa. And so we decided to have an Imbizo, and an Imbizo is a Southern African traditional way of coming together, the community coming together and share ideas or discuss pertinent issues that happens within the community. And during these discussions, everybody has an equal, or everybody is equal in the room. And this is an opportunity to share ideas and to communally agree on a way forward or recommendations to move forward. And yes, so we had a diverse group of individuals from government, the Ministry of Health, Ministry of Education, business, the faith-based organizations, as well as self-advocates. And this is where my life, my worldview really changed about when I was first sitting there. And then I realized that because I was upset because I thought nothing is happening in South Africa. And so this is where we discovered the good work that is really taking place in South Africa. We met Shelley, one of the first persons with Down syndrome, who she obtained a teacher's qualification without assistance. And so she was presenting, and again, I had that epiphany. And this is where I decided that this is perhaps my area. So I'm not in Down syndrome or brain health. My work is around health equity and how marginalized communities experience access to healthcare. And so this is where the project just expanded. We now are doing a national survey where we talk to caregivers of people with Down syndrome and their experience with the healthcare system. And again, here we discovered so many inequities that are happening. But one other observation I made while Sherry was presenting is another unfortunate inequity between, unfortunately, a racial inequity where more white people or persons with Down syndrome seem to be active, seems to be the ones doing, but within the black communities, little development. Those are the ones with speech, not well integrated in society. And so this project is also going to another level where we start addressing government, engaging with government. I work closely with Down Syndrome South Africa. We recently worked on a policy brief for the minister in order to advocate for services at primary healthcare level. We also, because from the deliberations at the Imbizo in the first place is a traditional African methodology, and so we also wanted to really dive deeper into indigenous knowledge systems and to really understand or find a common lexicon. And Eimear will probably tell us a little bit more about the Fundisa project.
Sure. I might first, if it's okay, just go a little bit back in terms of the context, and it fits exactly what you were saying around inequity. So a population with Down syndrome. So Down syndrome is a genetically determined form of Alzheimer's disease, which means that everyone with Down syndrome will have the neuropathology of Alzheimer's disease by the age of 40. And this is a relatively new. This was first proposed in 2021, so only about 5 years ago or so. But before that, there had been a really long history of knowing the connection and the higher risk of dementia for people with Down syndrome, but that historically, and really until only within the last decade or so, people with Down syndrome had been excluded from dementia research, certainly from any kind of clinical trials. And so it's a population that globally face a lot of inequity. So there is that inequity in terms of access to research. There are also other inequities, as Cormac was talking about, around social isolation and aspects that are going to increase risk factors for dementia, but also inequities around access to education, opportunities for employment, opportunities, again, to be part of the community. And so there were many of these global inequities, but then, as Atholl was saying, within the Down syndrome population, there are also other inequities. So you had mentioned race, and I know that from work that's been done in the US, that black people with Down syndrome are dying younger than white people with Down syndrome. And that really all of the research that's been done in Down syndrome-related Alzheimer's disease all comes from the US and Europe. And that was that conversation with Atholl in talking about the Down syndrome work in South Africa. As you said, there's been very little published, but actually at that Mbizo and really understanding the work that's happening on the ground, there's really incredible work. Down syndrome in South Africa are incredibly active. There's some amazing self-advocates, as you mentioned. And so there is a lot of work happening, but not published, and so it's not something that is more widely known. And so that was something really important that came out of that first Mbizo. And the other thing, linking then to the Fundisa project that you said, was within the Mbizo, through conversation, it came up that there are, within South Africa, 240,000 traditional healers and about 35,000 MDs. And so people, everyone, but including people with Down syndrome, most people are seeing traditional healers either as part of or for all of their healthcare. And we don't have an understanding, or there wasn't an understanding of how either Down syndrome, intellectual disability, or dementia is conceptualized within the indigenous knowledge system. So, for example, in the word dementia doesn't exist across many of the languages in South Africa. So when this has been researched before, often people come to the conclusion that people don't know about dementia, but that's, if you're using a Western scale with the word dementia, it's very hard to understand what people know in terms of how they conceptualize this. And so this is what the Fundisa project is trying to do, is to develop a framework to better understand how dementia, Down syndrome, intellectual disability, how these are conceptualized within Indigenous knowledge systems, with the goal of improving communication between Indigenous and biomedical knowledge systems.
As a choreographer, I like the fact you did this. Not all things are verbal, huh? So, in your wider work, how does this fit into your wider work? How do you connect it?
Yes. So my main work focuses on the experiences of LGBTIQ plus communities, lesbian, gay, bisexual, intersex, queer, and all other gender variant communities. And so the connections here is really the social justice issues and the stigma and the shame and discrimination that is attached to these bodies. And so I made that connection between Down syndrome and the LGBTIQ plus communities, in that looking also at equity to healthcare, they sort of face similar access issues to a healthcare system, but in terms of Down syndrome, and there's also stark differences. For instance, persons with Down syndrome also struggle to access the education system, especially in South Africa, where in mainstream basic education, most of the parents share their struggles, continuously fighting with the Ministry of Education to force them to allow these students within the schools, because education is also a social determinant of health. And we see the differences with those that are able to access education. They're more confident, they're easier integrated into society, whereas those that don't have the opportunity to access education struggle. And they are the ones that's normally hidden away at home because they cannot, interact with a society. And for me, it is so important to draw these parallels and to find the synergies between these, because LGBTIQ work is my passion. I am a queer a person, and for me it is central. It will be my work forever. I teach health systems, and I integrate queer theory within my work. It is important that we address the hegemony and the power structures of both within LGBTIQ healthcare as well as within Down syndrome, because there are gatekeepers and people that exclude these. And so one of the areas that I've also found commonalities is how we train our healthcare providers. So my PhD is looking at the lived experiences of health profession students who identify as LGBTIQ+ at historically disadvantaged universities in South Africa. And so again, a lot of medical professionals are not well trained even to take care of persons with Down syndrome. So there's real gaps within the health professions education. And so this is my new work, is to look at both of them at the same time, and how we integrate this into the health professions education.
So many things and so little time. Well, see how long we can stay with the problem. We have about 5 minutes. So one of the things we realised when started creating brain weeks around the world, or somewhere like the University of Jordan, is an expert in displacement, because it is across the border from Syria and people drag over. And so that is part of their lived experience. Huh? But they are the 1,272nd university in terms of university listings. And so knowledge that is made there is not valued in the same way. Knowledge wherever it gets made is contextual. How does it move around? What's it like, Eimear, to move between here and South African conversations? What are you learning from South Africa that you might bring back?
So I think what I had mentioned around that difference between what is published and what is happening is so huge. So the idea that before we went to it that there's so little happening, that it's just not true at all. There's so much happening, but that's not being published in the same way or publicised in the same way, maybe even. Unless you specifically go and looking for it, and then you see how much is there. Exactly, it kind of just opens so many areas, and I think that would be the same. So that's something that we noticed in South Africa, but I imagine that's the same within so many different communities where there's amazing community work happening, and that just because it's not publicised doesn't mean that transfers to there's nothing happening. So I think that was for sure a lot of learning. And I think just the power of the community engagement, I think. So within that Imbizo, there was a lot of family members, people from intellectual disability services, and everyone had stories about how they, as a community, supported each other in the absence of maybe more formal services that were there. So, for example, there was a mother, Doreen, that we're still working with, who... She runs this national WhatsApp group. Across Africa, there's maybe now 500 people who are generally mothers or family caregivers of people with Down syndrome. And it's a support group, and they meet every Wednesday. Every Wednesday it goes live, and people can just talk and share experiences or share information or share routes for other support or that kind of thing. And this was just set up by a family member. And I think those kind of examples are so powerful, and as often happens, and we see this, I know a lot of services here were also started by family members and then expand and get more support.
Atholl, the last word is going to go to you. What are you thinking about now? Where are you going with this?
So just before we go there, I just want to raise another. So we also went to present this work at a conference in Kenya, looking at dementia and Alzheimer's in low and middle income countries. And there also it was discovered that Down syndrome is the black sheep in dementia research. And I think it's so important that we also raise that awareness so that more research could go into that area. In terms of where we're going from here, so the next, I have, like I said, I'm not, it's not my core work, Down syndrome, so I am now busy educating myself in terms of Down syndrome and dementia. I spend a lot of time with caregivers, with families of Down syndrome, and I'm thinking to also make documentaries to really showcase the stories of Down syndrome in South Africa. We are working on another policy brief, so I'm really pushing the boundaries in terms of making services accessible at primary healthcare level, and so yeah, that's the plan for the next 5 years, but also to really find those synergies and to build on those synergies between Down syndrome and LGBTIQ work. So there's some entry points to consider there. It's older persons living with older persons, LGBTIQ persons, and their and dementia. Right? Also, what was the other one I was thinking of earlier? In terms of the connections between Down syndrome, dementia and LGBTIQ plus communities. But yeah, those are sort of the ideas going forward to sort of merge the two fields, and obviously to write more and to. We're going to have a lot of data from both studies, the national survey that we are currently doing and the Fundisa project. So with the Fundisa project, we're going to interview the medical doctors as well as the traditional healers in South Africa. And from that work, we'll see the possibilities that emerge from there.
Fantastic. Thank you so much for sharing this as it goes on its journey. It's just great to be able to revisit it, and it's also amazing to be able to revisit it with something like Shane Amara's work from this morning or Louise Foot's, to be able to see how this practice, this actual work, is the activity that the theorizing leads to. It's really great. Thank you so much.
Thank you so much.